Hi everybody, Dr. Fred here, and we're here with Amelia. And Amelia is probably one of our star patients. She's been with us a long time, and we've been with her a long time. So we just wanted to have a little chat and have her share some of her experience with us and share some things that she might have done with you, and maybe help you feel more comfortable about what we do here at Cornerstone Plastic Surgery. So, Amelia, how long ago do you think we started?
2022.
2022.
And that was with the breast reduction.
Right.
Yeah.
So you had a breast reduction with us, and what was that experience like?
It was a good experience. You know, I had put a lot of thought into it. I had actually, postponed it for quite some time, fearing, a lot of discomfort and pain and things like that. It actually went much better than I was expecting. No pain whatsoever afterwards, which I was very, very surprised.
Yeah, and we got a really nice result, I felt, and everything was doing well, but we did have a little bit of a complication.
A little bit of a complication, yes.
I think it's important for people to understand that, especially with some of the bigger surgeries, little things can go wrong, and sometimes they prolong your recovery. Ultimately, I think we got to a place when we got you through all that, where you're okay.
We did. It looks wonderful. I feel comfortable. It got resolved, and I was very happy with the personal attention that I got because you were on it.
Well, thank you, and you were great. I mean, it takes two of us to get through this, and that's the thing. I mean, surgery especially is really teamwork.
It is.
You both have to be on the same page.
Right, and I think it's easy, if you don't really understand the whole process, the procedure, some of the things that could go wrong. When you have someone that explains everything to you and shows you the attention and the care that you need at that time. I mean, you really put my mind at ease because I was scared.
Sure.
Initially.
Yeah. Well, these are scary things. But I'm glad everything turned out all right. But then we continued, and I think after that we started doing some little minor things because you've always been a very beautiful woman.
Well,
but you had some skin issues and, the normal things that everybody gets, and Botox.
Yeah.
So we did some resurfacing with the Cool Peel,
Mm-hmm.
and I think we did some skin tightening with the Morpheus, right?
Correct. Mm-hmm.
And you find that helped you a bit?
It did. It helped me to a certain point, and then we did the facelift after that. So.
But before that,
Mm-hmm.
we did something really big, which was you were a little bit overweight.
Right.
Yeah,
yes.
and that had happened slowly over years, right?
Well, pretty much once menopause hit, it was not my friend. And I had tried a lot of different diet plans and apps and things like that, and the only thing I lost was my money. So yes, when I had researched a little bit about semaglutide, and then when your office offered it, I hopped on board, and it was the best thing I did for myself.
Yeah. So for those of you that don't know, we have Rejuvenation, our wellness and med spa, and we're very lucky to have Dr. D. Simone, who's a board-certified internist and anti-aging specialist for really almost 40 years. So he worked with you, and how much weight do you think you lost?
At least 25 pounds. I'm off my blood pressure medicine. I don't have sugar cravings anymore. I have osteoarthritis in both of my knees, which are bone on bone. I haven't had an injection in over a year since I've lost the weight.
That's awesome.
Yeah, I feel good.
Yeah. So, as many of you know as well, that when you use semaglutide or Ozempic or Wegovy, sometimes the weight loss can be rapid, and sometimes what happens is you wind up with some sagging skin in places, especially around the face. But the nice thing about having this done where you have a plastic surgeon is that then when you did lose the weight, you felt that you were stable.
Mm-hmm.
You spoke to me about doing something about restoring, your jawline and your face the way you were.
Mm-hmm.
I think that went really well.
That went very well. I was very happy with the results because I was concerned. I didn't want to look like my skin had been pulled really tight. I wanted to look just like a refreshed version of myself because
Mm-hmm.
I'm not 20 anymore, and I wasn't trying to look like 20. I just wanted to look refreshed.
Yeah.
And I think you did an amazing job with that.
So we did full face and neck. Now you're just doing some maintenance stuff, right?
Mm-hmm.
So that's really wonderful. I mean, this took a couple of years probably to get through everything. I think you look awesome.
Thank you.
Yeah, and I think you look pretty close to where you were before. Does your husband like it?
He loves it.
Well,
That's what he
great.
tells me anyway.
And this is a lovely couple. You guys are good friends, aren't you?
Yeah, we are.
It seems like you are.
Mhm.
Yeah, that's nice. So he was supportive throughout the thing.
Very supportive, yes. As I am of him. You know.
And that's great because,
Mhm.
you know, some people wind up doing this alone, and that's okay. But when you do have family support or, you know,
Mhm.
spousal support or something, it really makes a difference.
It does. It makes
Yeah.
a huge difference. And there's nothing wrong with, you know, wanting to enhance what you already have and trying to be as healthy as possible when you're going about it.
And how do you think our girls, the staff, everybody treated you?
They're amazing. They're a great staff. They're very friendly, very knowledgeable, very professional. They're an asset to your company.
Well, that's great. Well, we try very hard. And now it's pretty much just skincare and keeping
Mhm.
fit, right?
Yeah, I'm good. I'm good for a while now, I think.
I think so. Well, Amelia, thank you so much.
Oh, you're
You've been a
welcome.
great
Thank you.
patient, and we really love you here.
Yeah, thank
All
you.
right.